This is Dr. Michael Brisman, neurosurgeon from Long Island, sharing with you some of my interesting cases. So this is a patient who's a 13-year-old girl who was experiencing some tingling episodes on the right arm and leg and some headaches. She was found to have this fairly moderate-sized AVM. This is a lateral angiogram on the left middle cerebral artery, and there's a fairly large AVM here, or moderate size AVM. There's also kind of an abnormal structuring to the blood vessels. It's consistent a bit with a partial Moyamoya picture. So it's not a totally normal structure of the blood vessels. But again, the main issue was the AVM, which was causing symptoms, and there's also concern for the ability to bleed over a lifetime. The bleed rate is usually about 3 to 4% per year, so she was pretty young. So she had a real risk of bleeding. I mean, one option is to embolize these and try to remove them surgically, which I thought was not a good choice because of the size of the AVM, because this arteriovenous malformation was in the motor region. So we decided instead to do Gamma Knife as a minimally invasive one-day outpatient treatment. This is showing the treatment itself. And at the day of treatment, this is the post-contrast axial T1 MRI. And we aim the focused radiation, and the yellow is the 50% isodose line. We aim the radiation just on the nidus, which is where the abnormal veins and abnormal arteries come together in a high flow tangle. So it's the nidus, and we aim at the nidus itself. This is another view of it, showing a sagittal view, and again, showing how we can target the nidus pretty tightly. And she did very well. And just to show you, this is several years later. This is her T2 axial MRI, which is good for looking at things. And you can see that this looks normal. I mean, you can't even tell she had an AVM ever or anything abnormal. She did very well. Her symptoms all resolved. Again, her images have remained perfect and normal. So again, I think even though this may appear like an insurmountable and very complicated problem, the treatment was actually a very simple, non-invasive, minimal risk, one-day outpatient intervention, and she did very well from that. So thank you for hearing about this interesting case.